welcome to meeting number 135 of the House of Commons Standing Committee on Health. Pursuant to the order of reference of May 29th, 2024, the committee will resume its study of Bill C-368, an act to amend the Food and Drugs Act.
Monsieur le Président.
Mr. Chair, Mr. Chair, apologize, but the sound is terrible. And I see that there's no one in the interpretation booths. So where is the interpreter? Because the sound is terrible.
If you get the other earpieces that have the other thing, then they can hear better.
Est-ce que des tests ont été faits avec
Were any tests conducted with the interpreters?
C'est pas la force, c'est le son.
Okay. I'm sorry, it's not it's something to do with the volume. I'll try this one.
Mr.
Thériault, to address your question, we don't have any participants online, so there were no connection tests as those that we usually conduct.
Okay. Okay, you have a new earpiece. Does it seem to be any better at this point? Call the meeting to order. Welcome to meeting number 135 of the House of Commons. C'est une amélioration? Okay.
Is there any improvement now?
All right. Pursuant to an order of reference of May 29th, 2024, the committee will resume its study of Bill C-368, an act to amend the Food and Drugs Act, Natural Health Products. I'd like to welcome our panel of witnesses. Joining us today for the first hour, we have the Honourable Mark Holland, Minister of Health, and we would also like to welcome the officials accompanying him today from the Department of Health, Dr. Supriya Sharma, Chief Medical Advisor, and Lindsay Hollett, Assistant Deputy Minister, Regulatory Operation and Enforcement Branch. Thank you all for being with us here today. Minister Holland, this is familiar territory for you. You have 5 minutes for your opening statement, and you now have the floor.
Thank you, Mr. Chair. Thank you for the opportunity to be back to committee to get an opportunity to talk to this bill. Let me say on the first order, natural health products are an extremely important part of the choices Canadians have as they make choices about their health and the products they wish to consume. But like all other products, it is essential we make sure they're safe. We can recall a tube of lipstick, we can recall a head of lettuce, but this bill would gut our ability to recall natural health products. Folks, this is a cuckoo bananas bill, with all due respect. And let me just give you an example. The U.S. FDA, in an incident detected the presence of filth, including animal feces, colored fibers, white paint chips, like material plastic adhering products.
Mr. Doherty has a point of order.
Yeah, I'm just going to ask if the minister, I wonder if he could just turn down his volume a little bit. It is awfully loud for those of us that do use the earpiece quite frequently. And so I can't imagine how loud it is for the interpreters as well too. So if he can just be just a little less loud into the mic. Thanks.
Thank you. Go ahead, Minister.
Well, thank you. Can I go back a little bit? Can I rewind the tape a little bit? If I push my microphone away, I know, Todd, you like me have a good outdoor voice, so I'll push the microphone away. I appreciate the note. But let me go back if I could. So I'm going to hit the timer here. So the U.S. FDA indicated to Health Canada the presence of filth, including animal feces, colored fibers, paint chips, a plastic adhering product, and a gummy dietary supplement produced in Canada. Health Canada did a report, an investigation, and found rodent droppings and urine. So let's be really clear about what this bill would do. This bill would mean that rodent droppings and urine, we have no ability to pull it from the shelves. So folks, if you want feces-contaminated natural health products sitting on shelves with Health Canada having no ability to pull them, then this bill is for you. But if you don't want your natural health products contaminated with things like fiberglass or paint chips or feces or urine, then I would suggest giving Health Canada the ability to pull those products is essential. Now, I've heard the committee talk about things like, well, you could do a stop sale. Absolutely. But a stop sale doesn't allow us to pull them from the shelves. And the idea that we can pull lipstick off the shelf, but not a natural health product, is a bananas notion. Now, the other thing that has been brought up is, well, fines. Oh my goodness, there's going to be $5 million of fines. It's not Health Canada that imposes these fines. It is the courts. Surely right now the maximum fine is $5,000. So do you want to say to a plant like I've just described here with rodent droppings and urine and paint chips, like, do you want to say to them, your maximum fine to the court is $5,000? And the most strange part is this is coming from a party that purports to be all about law and order. This is about giving the courts, not Health Canada, the tools they need to impose proper fines. Now, the other thing that, I just want to go over some of the things that are found. Mold, lead. In the example of lead, we have somebody who was hospitalized with lead poisoning. Can you imagine leaving that on the shelves and not having the ability to pull it off? People talk about vitamins. Let's talk about, in February of 2021, a product with high levels of undisclosed vitamin D resulted in a teenager being hospitalized for 10 days. And after we find that, this bill would take away our ability to take that off the shelf? Folks, that makes no sense. The other thing this bill does is deals with precision regulatory powers so that we can be nimble. And yes, that means, and I know this committee has been talking about issues about nicotine replacement therapy, and I'm glad the committee agrees that we should have the ability to protect our youth in that way. But what about pseudoephedrine? It's a precursor to making meth, right? Like, we need to have the ability to protect human health. And one of the things that's incredibly important, because let's talk about what this bill does and doesn't do. This bill isn't about labeling. This bill isn't about cost recovery. It has nothing to do with that. I'm happy to come back to this committee and have conversations on that topic. Those are good and important conversations that I want to have, but this bill has nothing to do with that, right? What this bill has to do with is killing Vanessa's Law. Vanessa's Law only comes into effect when there is a serious human health concern that is present. And I have been disappointed that there has been reference to a Deloitte study that was commissioned by industry that only looked at vitamins and minerals and only in hospital, and the Auditor General report is ignored. The Auditor General is talking about how serious this is, and the Auditor General's report is ignored, but an industry study in a very limited way done by Deloitte, paid for by industry, is suddenly what we're listening to. In terms of consultations, since, since 2016, 4,500 consumer and healthcare consultations. In 2019 alone, 70 different companies met. And I'll end on this point, Mr. Chair, which is in meeting with companies like Jameson, fantastic Canadian companies doing incredible things, hiring Canadians. That Canadian made in Canada means something, right? This costs people who comply or try to comply $0. But what it does do is when it says made in Canada and you sell that around the world, that it means something. It means that product's safe. It means it doesn't have feces in it. It means it doesn't have lead in it. It means it doesn't have undisclosed amounts of something that could make you sick in it. So if we can recall a tube of toothpaste, a lipstick, or a lettuce, why in God's name will we not be able to recall a natural health product?
Thank you, Minister. We'll now have rounds of questions from members, starting with the Conservatives for 6 minutes. Dr. Ellis.
Thank you very much, Chair. Minister, you know, we've been down this road before with you, and I guess let's start with some simple questions. You like to use some very emotionally charged language. How many Canadians don't have a family doctor? Just a number. Simple.
Well, according to the most recent report that was just released by CIHI, It depends on province. So you say Ontario is at 88% who do.
Just the number.
The lowest province about 79%. Territories are lower, particularly Nunavut being the lowest.
Minister, I'm going to interrupt you because, again, you and I have gone down this road many times, and you said you've read the report. How many, I'll say it perhaps slowly and clearer for you. How many Canadians
Across the country, it's known to be about 82% have
excuse me, Minister.
Okay.
Don't interrupt me. This is not your time for question. You'll have lots of time when you're in opposition to ask questions, if you so desire, or if you're able to keep your seat. That being said, how many Canadians don't have access to primary care in Canada? Just the number.
It's estimated at 6.5 million.
Actually, if you read the CIHI report, it says 5.4 million adults, correct?
Correct.
Yeah. So tell me this, is that number going up or going down?
In every province, in every territory, with I believe one exception, that the access to doctor is improving. There's been more doctors added, more nurses added. That's in the baseline CIHI report, so that's actually before our investment
again,
of $200
Minister, I don't
billion.
think that's what I asked you, is the number of Canadians who do not have access to a primary care physician going up or going down?
Access is going up. That in the baseline report, we see every province and every territory access to more doctors, more nurses in almost every jurisdiction. That's a baseline report. That is before the interventions of our signed agreements with every province, every territory, $200 billion being applied.
But we know
and I
very
can talk
clearly,
about all the
excuse me,
different ways that we're
Minister,
improving that
Minister,
circumstance, but conservative cuts certainly
of
aren't
that
going to help.
stuff. You know, again, if you don't want to be respectful, why do you even bother coming here?
I'm sorry, I don't find your questions or your demeanor respectful, so I don't know why I should reciprocate something that is not extended.
Point of order, Speaker.
Point of order, sir. Yeah.
Thank you, Chair. So I'm patiently listening to Mr. Alice's questioning, and I'm failing to see any relevance to the topic in hand, which is this particular bill dealing with natural health products. So unless he's got a long-winded way of getting to the presentation that we heard and the bill that we are reviewing, like him to focus on the bill that we're talking about. Thank you.
Yeah, I think it's valid. I'm not sure that there's a connection between access to family doctors and this private member's bill. This is not an examination of estimates where it's much more wide open. So
Point of order, though?
I do hope and expect that Dr. Ellis will get to the point, and I think it is a valid point of order. Did you have another one, Ms. Goodrich, or is it on this point?
I have a point of order on this point of order. The minister just very clearly said that he doesn't plan on respecting my colleague because he has decided that that is not something he's going to do. I don't think that is befitting of a formal committee meeting.
I think there's I think it's reciprocal, quite frankly, and it's too bad. The witness merits respect, as does the person posing the question, and that's why don't we treat everyone with respect around here, please? I wouldn't pin it on one side or the other based on what I've heard so far. Did you have something you want to say, Minister?
My reflection was simply that if I'm attacked and treated in the way that I am, I'm going to respond. And absolutely, I am here to answer questions.
Okay.
But I would suggest, Mr. Chair, that perhaps we could start with things germane to this bill.
Chair, point of order,
perhaps in a way
realistically,
that's
to the
conducive to
witness.
finding solutions
Who controls
instead
this
of
committee?
badgering
Is it
one
you,
another.
Chair, or is it the minister?
Please,
This
Dr.
is
Ellis,
ridiculous.
the minister has the floor.
It's ridiculous.
The minister has the floor.
Ridiculous.
I do not. I can tell you that and look, I was in opposition. I've been in the position that they are in, where you ask questions.
Okay.
And I am saying that there's not only is the
Thank you.
conversation not relevant,
Thank
but
you.
I don't think that
Okay.
it's at all respectful.
Thank you. Thank you. Thank you, Minister. Now, Mr. Doherty has a point of order.
Mr. Chair, it is commonplace within this committee, as well as other committees that I've sat on, that the length of a question is then therefore applied to the length of the answer. Where the frustration comes with this minister is that he tends to go on beyond the length of the time that it took to ask the question. As you know, members are given a specific allotment of time, and it is frustrating when you have ministers appear, not just this minister, but other ministers appear. And I know that this minister is well versed in the art of what we call ragging the puck, and so are other ministers, taking up the time of each member. So when my colleague and others ask a simple question, just a number, that's all that they look to receive. If we wanted the statistics for each province, I would offer through you, Mr. Chair, that would then bode the answer that the minister was going down. I can see that my colleague has done research and has a number of questions that he would like to ask. So I would ask through you to our minister is that if and when he can be concise, to please be concise.
A point of order, Chair.
Yes, Dr. Ellis.
Now, I know this is painful for you, I understand that, but since when does a witness get to direct a committee? All I suggest to you, and I know you won't like this, but do your job.
Ms. Sidu, do you have a point of order, or do you want to intervene on this one?
Yes, thank you, Mr. Chair. Mr. Chair, we invited a minister. Let's be respectful. When we are asked the question, minister has the right to give the answer. That's my point. Thank you.
3 minutes and 37 seconds.
Thank you very much, Chair. So, Minister, before all of the bombast, back to the questioning here. When we begin to look at Canadians, of course, because of your mismanagement of the health file, they have to look after themselves by virtue of turning to things such as natural health products. So your ineptitude, of course, has led many Canadians, of course, which we've heard from, using natural health products. That being said, how many Canadian seniors are hospitalized every year because of pharmaceutical products?
I believe that I was here for natural health products. I don't blame the member for not wanting to ask questions about this terrible bill. I wouldn't want to talk about this terrible bill either. So I understand his desire to talk about anything but this awful bill. I could tell him, because I'll bring it back to the bill, 772 severe adverse reactions from natural health products. That this member is supporting a bill that would not allow our ability to recall products that have those kinds of. So the types of hospitalizations.
Chair,
Minister, please go ahead, Dr. Ellis.
Chair, you know, clearly what we're seeing here is an aversion to answering questions. Very simply, this will connect. I know it's difficult for you. How many Canadian seniors are hospitalized every year due to pharmaceutical products?
I understand that it's
just the number, Minister.
I understand that it's. I get the same amount of time as he asked the question. Is that the rule?
Yep.
I understand that it's difficult for you to understand that I'm here on natural health products, that is the purpose of this study, and I understand why you wouldn't
Thank you very much,
answer
Minister.
questions on it.
I will interrupt you once again. Just the number. How many?
I am here to talk about natural health products. It is the
so-
purpose of this study,
so
and I
once
want to
again-
talk about it. I'm not going to let you
Thank
off
you,
the hook
Minister.
to not talk about your own
Thank
bill.
you, Minister. Once again, I'll move along because you clearly have no clue how many Canadian seniors are hospitalized every year due to pharmaceutical products, which again are under your purview. Would you care to answer that on behalf of Canadians or no? Simple answer. If you don't want to, or you don't know the answer, it's okay.
What I'm not going to do is engage in a attempt to not talk about this bill. You have not asked any questions related to this bill because you don't want to talk about how deadly this bill is. The fact that you would leave
Thank you very much, Minister.
products on the
I'll
shelves that are
interrupt you
dangerous
there.
to Canadians' health.
You know, the difficulty, of course, is, Minister, is that 13,000 Canadians are harmed by pharmaceutical products every year. Seniors hospitalized, 13,000, just because people need a reference. All you want to do is talk, you know, down to Canadians about feces and lead, all your fantastical words, of course. That's what your attempt to do. Minister, very simple question. How much does the NHP industry contribute to the GDP of Canada on a yearly basis?
Enormously. It is a booming industry,
Just
a
the number,
multi-billion-dollar industry. Am I allowed to answer the question in the same time that you took to
another
ask the
25
question?
seconds to answer the question.
Thank you. It is a booming industry. It is a growing industry. It is a multi-billion-dollar industry. But one of the things that will protect that industry is ensuring that that industry is afforded the protection of being able to recall
Thank you very
bad
much,
products.
Minister. Your time is up, but once again, I'll ask you just for the number.
Look, Mr. Chair, do I still have?
Yes, go ahead.
So one of the things that's when you're talking about adverse effects of pharmaceuticals, the idea that there's adverse effects on pharmaceuticals, so therefore you do nothing about natural health products? You just leave the people who have adverse effects for
Thank you,
natural
Minister.
health products with nothing?
Thank you.
How you draw your own conclusions. That being said, because of your negative effects on the natural health product industry, how many businesses are saying they're considering shuttering operations in Canada?
Vanessa's law does not affect any compliant or any business attempting to be compliant at all. Cost of businesses that are compliant or
Thank you
attempting
very
to be
much,
compliant
Minister.
is
You know,
exactly
you.
$0.
Thank you,
$0.
Thank you, Dr. Ellis. That's your time. Thank you. Mr. Nakvi, please, for 6 minutes.
Monsieur le Président, question de règlement.
Oui.
Mr. Chair, point of order. Please, listen up. The Conservatives had 6 minutes. We're now at 11:25, meaning that somehow we would need to. We had an hour with the minister, and I'd like us to have an hour with the minister, Mr. Chair. I would like that to be established right now, because I have serious questions to put to the minister. I would like the opportunity to ask those questions, and I would like to have the assurance that we can have the minister here for an hour, because we are only left with 25 minutes. So, is the minister committing to stay here for an hour? Thank you. An hour of questions and
Nakvi, please,
answers.
6 minutes.
Thank you very much, Chair Minister. Thank you for being here. And I am quite interested in this bill. I've done a fair bit of research on this bill, and I'm really concerned by its impact on the health and well-being of Canadians. Let me just start by making it very clear and hearing from you directly that this bill does not cover the issues around labeling and cost recovery, and it only covers the issue dealing with recall of products that are unsafe for Canadians. Am I correct?
Yes, along with the ability to use precision regulating powers to deal with things like we did with nicotine replacement therapy, or what I was talking about with pseudoephedrine as a precursor to meth, as an example.
So, given that it's got a very focused purpose behind this bill, Bill 368, what concerns do you have if this was passed into law, and how, in your view, it's going to increase the risk to the health of Canadians?
Well, this is an absolute threat to the health of Canadians. This bill is a terrible, awful bill. And look, I get it. If I was the Conservatives, I wouldn't want to ask questions or talk about it either. But here's the problem. And I've gone through the example of the rat feces and the urine. Let me go through some others. Let's talk about a young woman in 2021 who was taking natural health products that had unacceptable levels of lead. You should have no lead. Led to her poisoning. This really endangered this person's health. When you're talking about this vitamin D case, it also in 2021, undisclosed levels of vitamin D, teenager hospitalized for 10 days. Like, I just picked these out as some of the 772 serious adverse effects from 2021 to 2023. That's a 2-year period. Now, no one is disputing the importance of natural health products. They're incredibly important. They should be available to Canadians. But what does it mean when it says made in Canada? It means you can trust it, right? It means that you're not going to leave something on the shelf with contaminated by rat feces, or contaminated by fiberglass, or contaminated by lead. And the idea that we would take away our ability to recall that is I think would be frightening to most Canadians. And so yes, one of my objectives is to pull this out of the subreddits where this has been lingering, where there's a lot of false information, and to pull it out into the light of day. Because I am certain that most Canadians would be horrified at what this bill would do.
So, I know my Conservative friends love to talk about common sense. So at a common sense level, the current law, the Vanessa law, what it does, if the product is unsafe, it allows Health Canada, from a compliance perspective, be able to take that harmful product off the shelves so that somebody who's looking for that product is not able to use it because it will be detrimental to health. That's something Canadians expect of their government to do. Am I correct? And that's what Vanessa law does.
Absolutely. I think that as health minister, the safety of Canadians is my #1 concern, as I know it is for every member here. So we have a duty of care that anything that is ingested or used by Canadians, that we ensure that it's safe. and that it's not going to make them sick, this bill would jeopardize that.
So there's a narrative that's building out there that in the absence of Vanessa's law, that somehow Health Canada already have some powers, like stop sale powers, that would allow for that. And we heard that from Mr. Calkins, the sponsor of the bill, repeatedly. Can you walk us through how that power does not work, and what does Vanessa bill, which this particular PMB guts it, helps ensure safety for Canadians?
Right. So let me give you a specific example and where it could have been used. So in 2019, Health Canada received a consumer complaint. They had an adverse reaction leading to hospitalization after taking an unlicensed Crantum product. The Health Canada requested the firm stop the sale of the product. So that's the power we had at the time to say, look, you got to stop selling this product. The problem is that we had no power to pull it from the shelves. So it just sits there on the shelf with dangerously contaminated. And that leaves us to, beg and plead for the individual to take this off the shelf, to chase down, the places where it might be, and ask them, pretty please take it off the shelves. Like, it doesn't exist anywhere else that we would allow that kind of thing to happen. And so what this Vanessa's law does is it makes sure two very important things. One, for that plant that I was talking about that was contaminated with animal feces and urine, that we can, A, recall their products so that nobody is using those products that are contaminated, and B, empower the courts, not us, the courts, to, in a judicial process, be able to determine what is an appropriate fine for their negligence, to ensure that there is a penalty associated with that negligence. Now, the last point, and this is an extremely important point, is that if you are compliant or trying to be compliant, then this never gets triggered. So if for a company that's a good actor, the cost of this of Vanessa's law is exactly $0. In fact, I would argue by undermining the Made in Canada brand, by creating a circumstance where there is uncertainty about whether or not products on the shelves are safe, that makes Canadian products worth less. It makes Canadian companies at risk in terms of their global brand recognition, because when you talk to a company, I'm sorry to pick on Jameson, I was there recently. Jameson's an amazing company. When they sell around the world, what they'll tell you is that Canadian, Made in Canada, Health Canada regulated brand is worth so much to them as they export around the world. We have to protect that.
Thank you, Minister. Suite Monsieur Thériault pour 6 minutes, s'il vous plaît.
Thériault for 6 minutes, please. Thank you, Mr. Chair. I'm a bit surprised with the tone, the opening tone of the minister with regard to this issue, because if we're discussing this bill, it's simply because government introduced in shady bill C-47, it's those obligations. So very sincerely, I think they camouflaged all of this while they were in conversation with industry in order to ensure that we're able to distinguish natural health products from other products. And that's the basic point. And when you come in committee, and I apologize, Mr. Minister, but you had an attitude and a disrespectful tone with regard to members here. And also, if I was a member of industry, of pharmaceutical industries, I would not be very happy. You're very specific in your words, saying that it's an entire disaster. There's been 251 recalls on natural products from Health Canada, and out of these 250 recalls, I hear that there were 31 public notices, and these notices are only put out when the problem is really serious. And out of this, from these ones, what was the reaction and collaboration from the companies involved, Mr. Minister? Well, I'm really not happy. I mean, I don't want to know if you're happy or not, but I'd like you to address my question. I think there's an equal tone for each question. Mr. Thériault, in a minute. So in the first instance, yes, I'm unhappy because the bill here threatens the health of everyone across the country, and it is ridiculous, the debate on this bill. because there's a lot of wrong information, and that's the reason why I'm here, to clearly speak on the fact that this is a threat to our health in the first case. Now, secondly, there's a difference between the bill here and the stakes of this bill, which removes products with contaminants. And we contrast this with other stakes. And yes, there are different stakes. There's the ability to increase the manner in which we manage natural products. And that's an entirely different conversation altogether, which has nothing to do with the bill, and which has no relevance to the current bill. Thank you. Mr. Chair, thank you. So you would like to have your recall right? I'll give it to you, and I'll introduce an amendment to this bill. So as soon as I bring an amendment to this bill and I give you that right to recall, is the bill still that irrelevant to you? Well, I'm very open to any changes as long as it protects the stakes that I raised here, because if it's possible to recall products that are a threat to people's health, and if there's the possibility of introducing an amendment in a way that protects the health of everyone else across the country, yes, I'd be completely amenable to that. But that's another discussion altogether. But between you and me, I'm completely open to that idea. Well, Mr. Minister, I'm announcing that I'll make that amendment, and I think that natural health products have nothing to do in the Vanessa law. So this will allow us to be able to carry on the conversations that you're having in order to find points of convergence between the industry and the willingness of this industry to clean up things with respect to the poor quality products. And I think that it's interesting to allow them the opportunity to do things right. Having said this, I have another question for you. Nicotine-based products constitute one of the main objections to the draft bill. If I introduce an amendment, Mr. Minister, to the effect that nicotine-based products will not be targeted by this bill, at that point in time, do we address your health needs? Because for me, nicotine is a drug, and I consider this to be a hard drug in terms of dependency, and this should not be considered as a natural health product. Now, at that point in time, will the bill be more acceptable to you, Mr. Minister?
I think I've talked clearly about the things that really worry me about this bill. And I spoke very forcefully about that because I need it to be heard. This is a real danger. In the second order, conversations around the management of things like nicotine replacement therapies, which don't have tobacco, using an act that's really for tobacco and vaping. I'm willing to have that conversation. I understand your objective, but I would say, what about the precision regulatory ability to go after pseudoephedrine, which is a precursor to methamphetamine? We need to have the ability, writ large, to be able to act in an agile way to an ever-evolving environment. Because unfortunately, for example, on the manufacture of illicit drugs, a lot of things that can seem very innocuous can suddenly be used in very dangerous ways. So maintaining that precision regulatory power is something that I think is very important to protect the country. But I would say, to your other point, and every conversation you and I have had, Luke, has been centered in very reasonable positions. And I apologize for speaking in English, but things like pseudoephedrine and precursors to methamphetamine is not something I'd say well in French.
Merci, Monsieur Thériault. Et le ministre.
Thank you, Mr. Thériault. Thank you, Mr. Minister.
Thank you, Mr. Chair. And we all understand that the natural health products industry is an important industry, and that so many Canadians, millions of Canadians, depend on natural health products. I count myself among them. And so I have some questions on the bill. But before I come to that, I couldn't resist, given Dr. Ellis's line of questioning, in asking you to dispel a couple of myths that have occurred or been passed around the Health Committee table. The first being that the dental care program that the NDP pushed for and worked with successfully doesn't exist. The second, that pharmacare has no future. So my questions to you are simply this. First off, how many Canadians have benefited from the Canadian Dental Care Program to date in the first 24 weeks of the program? Secondly, how many provinces have indicated an interest in signing up to the pharmacare program that will cover diabetes medication and
We have a
devices and
point of order
contraception?
from Mr. Doherty.
You've got to be kidding. You've got to be kidding.
Go ahead, Mr. Doherty.
I'm not kidding.
You've got to be kidding.
Respectfully, Mr. Chair, where's the relevance to this? Next, you're going to have the minister talking about Canadians gargling with gasoline, which we know is a complete falsehood. At least Dr. Ellis had relevance towards his line of questioning, comparing pharmaceuticals to the natural health products. Far be it from the NDP to want to cover all the bases and keep whatever semblance of coalition with their friends there. But Mr. Speaker, I ask you, I won't be as blunt as my colleague, but please, there has to be some relevance to the topic that we're talking about here. But if our friend from the NDP wants to wax on and on and on and use his time to ask these type of questions, far be it from me, but there has to be some relevance. Mr. Nakvi spoke eloquently about relevance, so we're doing the same.
Sauce for the goose comes to mind.
Sorry.
No. This is a procedural point of order, Minister, and I'm going to rule on this, and we're going to move on, and you'll be able to provide evidence. So, Mr. Nakvi was right. Mr. Doherty was right. It didn't change the fact that there was a line of questioning that wasn't related to the bill earlier in the day. There is a large discretion when it comes to relevance in any parliamentary proceeding. This is the first question coming from Mr. Julian. I trust that he will either tie it into the bill or will dispense with this and move on. But I'm going to give the floor back to Mr. Julian just so that we see where he's going before doing anything more drastic. And it is normal to afford some latitude before intervening.
On another matter, Mr. Chair, there's an assertion that a lie occurred.
Point of order, Chair.
Mr. Minister, please. Mr. Julian has the
His name is
floor.
Rylan. It's a real story. You can visit him in Dalhousie University.
Back to Mr. Julian, please. Excuse me, Mr. Julian has the floor. Mr. Julian, I recognize Mr. Julian.
2 questions, and I'd ask the minister to respond.
Look, I think the facts are so clear in this case. I kind of agree. It doesn't make a lot of sense to talk about this bill. It's an awful, terrible bill. But I'm happy, I guess, now at this point to take other types of questions. Yeah, I mean, it's true. The Conservatives said that the dental care program didn't exist. And we're about to hit 1 million people who receive care on the precipice of it. Now, the last time I checked, 1 million people is a long way off of not existing. And in terms of pharmacare, just as we've been getting it done on dental care, we're going to do it on pharmacare. And we've got a lot of very interested provinces. We'll be signing deals. And I'll tell you why this is big, because something like take diabetes. Diabetes costs us $30 billion every single year. And it's going up every single year. People getting their medication matters. We have to be upstream. We have to be preventing. And I'll bring it back to this bill. That includes preventing adverse outcomes that are entirely preventable. Vanessa's law allows us to prevent people from getting sick by making sure that products aren't safe or pulled from shelves. Why on earth would we want people winding up in hospital from something that was entirely avoidable?
Thank you, Mr. Chair. You didn't actually answer my second question, but hopefully you can do that a little bit later on. Coming back to the bill. Now, Blaine Calkins, who's the originator, Mr. Calkins of the bill, came forward at this committee and said the following in terms of the powers that Health Canada already has, and I'm quoting him. They have the ability to stop a sale. They have border power for personal use imports where they can seize any product that they want. They can revoke a site license for any of the sites, and they can mandate a label change anytime and add warnings they want to products. They can inspect site licenses. They can expect any product. They approve every natural health product that is out there, the number, and they can revoke a natural product number and cancel the product. So that was his testimony. How do you respond to that? And are those all powers that Health Canada has now? And if so, why aren't those powers being used?
So great question. And the answer is they are being used, but the problem is we can't stop at retail, right? So what Vanessa's law allows us to do, and let me use the example where because you talked about a foreign jurisdiction identifying a contamination problem. When the US FDA said you've got a plant that is full of feces and urine, right here, Dr. Ellis, it's a real case. And this is a situation where...
Point of order, Chair.
Point of order from Dr. Ellis.
So interestingly enough, the characterization the minister says is a plant was full of feces. I would like to have him table the evidence of the plant full of feces.
Well, when you get the floor, you get a chance to ask him to do that. Go ahead, Mr. Julian.
Maybe there's an acceptable level of rodent feces and urine that Mr. Ellis has for a natural health product facility. I don't have that, right? I mean, if rat poop and urine is in a facility, you can debate how much it was. Maybe if there's only a certain amount of rat poop and urine, that's enough for you. It's not enough for me. That there's an instance when the US FDA tells us this. Yes, we can stop from importing anymore, but anything that's on the other side of the border and on store shelves, we can't do anything about. Vanessa's law allows us to take those products off the shelves. That's what's so critical. We lack the ability today. And here's the second most important point, and let's talk about that facility. That facility, now only the maximum fine the courts can issue is $5,000. And I would say that's a cost of doing business. Why have a clean or healthy site producing products if the worst thing a court can do to you is give you a $5,000 fine? The courts need the ability to scale those fines to make sure that bad actors are appropriately punished.
How much time do I have? I want to come back to revoking the natural health product number and canceling the product and the impacts that you have, Health Canada has already, the abilities, the powers. But I also want to follow up on Mr. Theriault's question, which was 350 recalls that were voluntary in nature. Of those recalls, how many did the company not cooperate, where the company was non-compliant? Because I think regarding this bill, and the impacts of this bill, we need to make sure that there is a problem. And part of that is whether or not companies have been compliant with recalls that have been issued voluntarily.
So alternative officials for the exact number, I can say there's largely been compliance. The concern is that when there isn't, that we lack the ability to do anything about it. And as you could appreciate, if you have a really flagrant violation, and I just gave you an example of one right here that was very flagrant, and there are other examples that are flagrant, that if we don't have the ability in court to be able to have a penalty that's commensurate with the size of what they did. So as an example, you may only have a very small number of cases where somebody commits a crime, but you still need a mechanism to deal with it when they do commit a crime, right? And so that deterrent effect is extremely important, and our ability to protect consumers when there is a flagrant violation is extremely important. I don't know if you want to speak to the specific number.
Very briefly, please.
Yes. So as the minister mentioned, the industry is very compliant, very cooperative, most regulated parties. What we have had is instances, and they are a small number, but serious instances where the time taken to convince a company to undertake a recall is weeks into the months, or a company, again a small number, refuses, and we need to find a workaround, someone else in the supply chain who is willing to work with us.
Thank you. Thank you. That's your time. Thank you, Ms. Hollett. Next, Mr. Moore, please, for 5 minutes.
Thank you, Mr. Chair. Thank you, Minister. Minister, does Health Canada commission studies? Yes. And does Health Canada expect Canadians to take value from those studies?
Absolutely.
Does Health Canada contract with Deloitte?
Yes.
Okay. So you expect the studies that you have commissioned with Deloitte to add value to Canadians, but if anyone else commissions a study, maybe with Deloitte, maybe someone else, you completely undermine it. You came in here this morning, you started your remarks by saying, with all due respect, and then you completely dumped all over an industry, which according to this Deloitte study, which I have no reason to doubt, new labeling and restrictions are likely to add substantial cost. The results show the new legislation will have dire consequences for the sector and the broader economy. The sector is mainly dominated by small businesses of less than 50 employees. Growth in Canada from 4.3 billion in total sales in 2007 to 13.2 billion in total sales in 2001. So as is so often the case, your government and yourself are going to be bringing the hammer down, as only a Liberal government can, on hardworking entrepreneurs and small business, all the while turning a blind eye to criminals, for example. And this Deloitte study, which I referenced, and have no reason to doubt, shows that 20% of the businesses I just mentioned would move their operations outside of Canada with your government's heavy-handed approach. So why would you want businesses to move to the U.S., where Canadians would continue to purchase their products online, but now Health Canada will not have any ability to have oversight?
Thank you for your question. In the first order, I didn't dump on the industry. I dumped on the bill. Two very different things. The industry is fantastic. The point that I made is the bill is awful. The second point is that my criticism of the Deloitte study was that it only dealt with vitamins and minerals, and it only dealt with hospital settings. It was very, very narrow in scope. And yeah, it was commissioned by the industry. The third point is most of the issues that you're talking about that affect industry deal with labeling and deal with cost recovery, which this bill has absolutely nothing to do with. The exact cost, to go back to be very clear, because you said you talk about turning a blind eye to criminals. A blind eye to criminals would be leaving a $5,000 fine for an incredibly negligent firm. If you are compliant, sir, you have absolutely nothing to fear from this bill. In fact, if you're working to be compliant, you have nothing to be fearful of this bill. It is only in cases of egregious negligence where these measures kick in. And it is not us who adjudicates the penalty, it is the courts. And I would suggest to you that somebody is negligent, resulting in potentially a death or somebody being hospitalized, is a gross form of negligence that needs to be dealt with in the courts. And it would, in fact, be blind, to use your nomenclature, it would be blind to leave the system in place that would allow that kind of gross negligence to occur. And lastly, in terms of the Canadian brand, why would you go and buy something from any country other than one that had the best regulatory regime to make sure they're safe? And whether or not it was smoke-free Ontario or seat belts, I heard these arguments again and again and again. You do something that creates safety, you're going to kill business. 10 out of 10 times, not the case. Improved business, improved safety, improved outcomes.
Minister, you know, I took note of one very loose thread that you mentioned here about a precursor to meth. How do you reconcile that? Everyone acknowledges, I would think, I know that you have been defending the indefensible as of late, including defending this Prime Minister that 4 out of 5 Canadians want to step down, but you continue to defend him, and now you're defending your government's approach, heavy-handed approach that targets small business while turning a blind eye, as I mentioned, to real criminals. You will recall your government's Bill C-5. You introduced the subject of meth into this discussion, so I'm going to ask you a question on this. How do you reconcile your government's legislation that says for importing and exporting Schedule I drugs, for producing Schedule I drugs in Canada, that means running a meth lab, for example. Now an individual convicted of running a meth lab or importing meth or importing a precursor product for meth or cocaine or heroin, now they can serve their sentence from the comfort of their home. I think Canadians now know with hindsight that your government got it wrong when it came to illegal drugs. But how do you reconcile coming down?
Pelosi.
I'm seldom one to do this, but this has come up repeatedly. How is this relevant at all with the private members bill, a conservative private members bill that we're here to discuss?
Well,
Yeah,
there's been numerous questions of questionable relevance come up. As I indicated before, I'm going to be consistent and allow latitude on this. The problem with allowing latitude on this, Mr. Moore, is that you're out of time. So if you could bring your question to a conclusion, we'll allow the minister 30 seconds to respond, and we'll go on with the next person on the list. Go ahead.
Thank you, Chair. Yeah, I was just about to conclude because the minister mentioned meth. How does he reconcile coming down with a heavy hand on hardworking New Brunswick small businesses while allowing those that run meth labs to serve their sentence if they're caught and convicted from the comfort of their own home?
First of all, the only
response,
thing,
please.
yes, sir. And look, I wouldn't want to ask questions about this horrible bill either, but in the first order, the only people that are coming down hard on are people who are negligent and wildly out of compliance. That's the only thing that the Vanessa's Law does. So if there's anybody in New Brunswick who is being come down hard on, it's because they're wickedly negligent, right? I mean, that's what we're dealing with here. And with respect to the policies that you talked about on crime, Newt Gingrich proposed the same approach you're talking to crime. Okay. He called it the greatest disaster of his career. Every place it's been tried, it's an abject and total failure. I will stick to science. I will stick to data. I will stick to evidence. And I will not follow approaches that, I guess sound good for a slogan, but have no basis in evidentiary truth.
Thank you, Minister. Ms. Sidhu, please, for 5 minutes.
Thank you, Mr. Chair. Thank you, Minister and whole team, for being with us. Approximately 70% of Canadians use a natural health product. And you talked about the stick to data, stick to evidence. But, Minister, removing natural health products from the definition would remove Health Canada's ability to recall natural health products. Health Canada would be able to recall a head of lettuce contaminated with E. coli or milk contamination with Listeria, but unable to recall a natural health product contaminated with the feces or, you named few. How it is fair for all Canadians' health? Can you explain that?
Well, it's a great question, and of course it isn't fair and it is dangerous, but moreover, I've had the opportunity to meet with all kinds of companies, and what they tell me is they want a fair and level playing field, and I think that it's deeply unfair to create a circumstance where good actors who respond quickly to stop sale orders, who voluntarily comply, are left to compete with companies that don't, and that's what would happen here. If you're a bad actor, all you face is a $5,000 fine. That's a cost of doing business. Basically, you can operate however out of control way you want to, and we're put in a terrible position of trying to comply and create fairness. And I can tell you, for the companies that I talk to, they don't want that. Companies, and we got a lot of fantastic Canadian companies employing people, growing their business, multi-billion dollars. And what they're asking for is to make sure that Health Canada has got the powers, that they're keeping a level playing field, where the good actors, the ones who are trying to keep people safe and be a good business and have good business practices, aren't put in a disadvantaged position because there are weak regulations to deal with bad actors. And that's what this is about. And to me, that's fundamentally fair.
Thank you. The Public Account Committee, including CPC members Jeremy Patzer, Philip Lawrence, requested the Health Canada revise the fines and penalties. But in place of NHP's their 2022 report, government agreed with the Public Accounts Committee as the lack of a proper determinant has led to high level of non-compliance within the NHP industry. Why do you think the CPC have a flip-flop on this issue? Can you talk about that?
I don't know. I mean, I think that in fairness, there's been an enormous amount of misinformation. And that misinformation has created a lot of fear in businesses. And when I actually talk to small businesses who are in this space, and you explain what Vanessa's Law does and why, if they're compliant or even trying to be compliant, they have nothing to fear, this is good for their business. They're fully supportive of it. And so I think we have to, and it's one of the reasons I'm talking so plainly today, we've got to cut through the misinformation. It's really doing an enormous amount of damage. And by the way, the false and misleading claims are, like, one of the things that we have to have a conversation in this committee, all the claims with products that cure cancer, just to pick on that as an example. There are people who then take products, think it's curing their cancer, and are avoiding traditional treatments, right? I don't mind you using something in conjunction with your traditional treatment, but you should be talking to your physician about that. And when companies are making bold-faced false claims, that can change consumer behavior in a way that's injurious to their health. So that's what I'm concerned about here. And I think that this false argument that somehow it hurts the economy to have strong regulation is malarkey. We know the natural health product. I hear from consumers all the time. I like to buy my products from Canada because I know they're well regulated. I know that what's in the bottle is going to be safe and that I can trust what's in there. What a marketing opportunity. What an advantage over other countries. Why would we lose that? Why would we ever do anything to undercut that? Because we take away one of the greatest competitive advantages that we have that allow so many different companies that are Canadian in this space to be booming. I am their biggest ally. I want them to succeed. I want them to be selling more all around the world. And it is my deep and heartfelt belief that having strong regulations and protecting those products is exactly how we get it done.
Thank you. Do you have more time? Okay, do you want anything else? Do you want to give a message to Canadians?
No. I think that the big thing here is that I just get frustrated with the attempt to use misinformation to confuse these businesses that are just trying to make a living, and they're getting letters and false information and spun left and right and told things that are completely false. Most of the issues that they're being told to worry about, this bill has nothing to do with. And I would welcome if the committee wants to have a conversation in a more in-depth way about how we can do a better job with natural health products and supporting them. I'm totally open to that. Luke asked a very fair question, which is there a way to amend this bill in a way that isn't injurious to people's health that improve the industry? I'm absolutely open to that. But killing Vanessa's Law and the ability to recall, that's just not smart. And that is actually going to hurt industry as well as public safety.
Thank you, Minister. Et maintenant, plus de questions raisonnables de M. Thériault pour 2 minutes et
Now,
demie.
more reasonable questions from Mr. Thériault for 2.5 minutes. Well, let's not exaggerate. It's not about killing the Vanessa Law here. So, on the question of the precursors of methamphetamines, I would like you to reach Section 7.1 on the Drugs and Food Act, and I know that this is not directly linked to the bill, but I have you right before me, and this will make the interaction with the industry much easier. When we had a meeting last time, I asked you a question on a committee of experts that had put out a final report on the Act on Cannabis, and they had made a recommendation to review the packaging and messaging laws for cannabis products. Now, if this is good for cannabis products, it's equally good for natural health products. You said you'd go ahead with this, and this was a yes, and that you'd have QR codes for cannabis products. This should be good as good an idea for natural products as well. Well, for me, I think it's important to have equal treatment for any type of products as far as protecting the population in general is concerned. And I think this is an important discussion to ensure that there's equality of measures here, that all the regulations are logical and useful in nature, and I'm completely open to any conversation on that topic. And maybe this is a good idea with your example to present the information in contrast with the other, and explain why this is the case for one product and not for the other. And if there's not a good response and it is not an equal measure, I'm open to have a conversation in that respect and produce the information with contrast on both ends. So you mentioned that you go ahead with QR codes for cannabis products. So imagine that natural health products, the solution would equally apply with the proper use of the QR codes. And your response, is it a yes or no, or maybe? Well, I'll say maybe, and I'll address your question more clearly with more information. And right now, we don't have a lot of information. So for cannabis products, it's yes, and for natural health products, it's maybe. Yes, I agree. I mean, I understand. Do I have more time? Maybe I shouldn't have asked.
Okay. Ça, c'est tout le temps alloué.
Well, that is all the time you had, Mr. Julien, for 2.5 minutes, please.
Chair, I'd like to come back to the question about non-compliant companies. I'd asked about the 350 recalls. And I really want to know, and I understand the issue around delays. Putting aside the issue of delays, how many of the 350 recalls were non-compliant companies? And was it one actor or a number of companies?
And I'm not, if we have the exact number, I'll allow it to be given. But I just want to say in front, part of the problem, of course, is that when you encounter a situation like the one I talked with the U.S. FDA flag something, and we don't have the power to pull it from the shelves, those are real situations. They have happened. They don't need to happen a lot to be very dangerous. But I'll pass it over.
Of the 350 recalls that have been mentioned, and a member mentioned this previously, those led to 31 public advisories. Of those 31, we had 3 companies that were simply uncooperative, so 10%. But I would ask members not to forget that what's missing in that number is those that it took a lot of time, energy, and hours.
I understand the delays, but coming back to the issue of non-compliance, so there were 3 cases of non-compliance or 3 companies that had more than 3 cases of non-compliance?
Of the 350, 31 were serious enough that we had to do a public risk comms, and of those 31 where risk comms were required, 3 of the 31 were uncooperative.
And those are 3 different companies?
Yes.
Okay, thank you. That's helpful for us to... Yeah. So coming back to 2 other questions that weren't answered, the issue around... as Mr. Calkins had testified, that every natural health product number is approved by Health Canada, that Health Canada has the ability to revoke a natural health product number and cancel the product. I wanted to come back to ask you that, Minister. And with a few seconds left as well, if you could answer my question about the number of provinces that have stepped up on pharmacare, that are interested in the pharmacare program. And thank you for the information of 1 million Canadians who benefited from dental care. I think that's hopefully the Conservative MPs will send out to their ridings as well.
Yeah, it's the problem is it's not immediate, so that those products continue to exist out there and be in a retail landscape, so that even once you exercise that power to arrest it, it continues to exist out there. And every day that it exists is somebody who could be hospitalized. So I would say that while there are 3 that were intransigent and really were very difficult in terms of compliance, the 31 that were in a state that were so serious that you had to issue that advisory are circumstances where those products were staying on shelves for an unacceptable length of time, really risking human life in the ways like I talk about the people being hospitalized for lead poisoning or for having too much vitamin D. Like these are people going to hospitals in those instances.
Thank you, Minister.
I'll have to come back on the other side.
We're past the top of the hour, but there's been a lot of wrangling. If you could stay for 10 minutes, we could get 1 round each from the Liberals and the Conservatives, and that would take us to the end of the second round. Do you have 10 minutes?
Is that okay? I have a press conference that I'm supposed to be in a prep for, but could we maybe just do 3 minutes each? Is that okay?
Yeah. Okay. If that's the time you have, we'll take it. So next up is Ms. Goodridge for 3 minutes, please.
Thank you, Mr. Chair. So was there a gender-based analysis done prior to the omnibus bill through the Budget Implementation Act of 2023 performed? Yes or no?
Yes, and with respect to using the Budget Implementation Act for regulations is normal practice. It was done by Conservative and Liberal governments.
Yes, I'm fully aware. Was a gender-based analysis specifically done on the natural health product piece?
The answer is yes. We'd be happy to provide it with you.
Please table it with the committee. So my next question is, did you look at the impacts on traditional Indigenous medicines and how this will impact them? Because this is going to be devastating to traditional harvesters.
No, it won't be, because it only deals with non-compliance and those who aren't trying to comply, so it would in no way affect those that were trying to comply with Health Canada regulations.
But Minister, you are using effectively a sledgehammer rather than a rubber mallet when it comes to natural health products. You are treating people like they are criminals before they've actually done anything wrong. That is precisely, you say you are supportive of this industry and you talk at length about feces and other things. That is a very small minority of situations. And bad actors, you have other tools in your disposal. If you really wanted to deal with them, you could create specific rubber mallet sort of solutions to deal with them. But you sit there shaking your head, playing politics with this rather than actually working with people. So why won't you look at common sense solutions to actually create ways to keep Canadians safe but allow access to natural health products?
Well, first of all, in the deepest part of my soul, I believe that repealing Vanessa's law is bad for human health. It has nothing to do with politics. It has to do with safety. Secondly, with respect to a sledgehammer versus rubber mallet, this only comes into effect where there's a serious violation and where their human health is at risk. That's I don't have any ability to use these powers until they're in the situation.
I've got very few.
I'm sorry.
I have 3 minutes in total.
Was there equivalency in a question?
Go ahead.
Yeah. So it's really important to make that distinction. That these powers only come into force when there is a serious human health risk. So you're right. Most of the times that doesn't arrive, thank God.
Okay,
but when it does, that's when these powers are triggered.
Minister,
and that's why these powers must stay.
Thank you, Minister.
Minister, you were in power for 9 years. You've been in power for 9 years. You didn't decide to make a single change to this until the last year. Why such a long time if you claim that this is such a serious, egregious issue? We've now heard that there were 350 issues, 31 that had public advisories, and only 3 that were uncooperative. Why not come up with a policy that will deal with those 3 rather than thousands and thousands? Canadian female entrepreneurs. This industry is primarily female entrepreneurs. I've been shocked by the number of constituents that have reached out to me, people from across the country that are really concerned about this, and it's primarily from women.
Yeah, and if they got the right information that this doesn't affect compliant businesses, then they wouldn't be concerned, and hopefully you'd help spread that. There was an attempt in 2014 to do this that was shot down by the then Conservative government. That's too bad. In 2016, we began negotiations as a government, and the reason why, I mean, look, you can't have it both ways. You can't attack us for not having enough consultations and then attack us because the consultations were too long. I mean, you got to pick one. So since 2016, we've been having consultations, and because of all the misinformation being thrown around, yeah, unfortunately, it's taken this long. And you both are attacking me for not having enough consultations, and now I'm being attacked for having too many.
I never attacked you for too many
Ms.
consultations.
Goodrich. The last round of questions for 3 minutes will go to Ms. Kayabaga, please.
Thank you, Chair. Through you to the Minister, I know there's been a lot of time that's been wasted to actually ask questions that can answer some of the concerns that people who are in the sector in our communities are having. Could you tell us, things that we should know? Like, for example, there's been a question around whether or not this is going to increase costs on Canadians, or any other thing that I may not have, 5 minutes to be able to ask, including the cost on Canadians. If you could debunk that, would be great.
Yeah, I think if you could spend, and I hope people who are in the industry watch this, to know I'm cheering for you. I want you to succeed. And just like when we had Smoke-Free Ontario come in, and people told me, talking to the restaurant industry, this is the end of restaurants. It's going to destroy everything. Everybody's going to move elsewhere. Didn't happen, folks. You can go back and watch the videos on seatbelts. Going to destroy industry. Going to make everything terrible. This is what happens, right? Is that conservatives use these arguments, this fear mongering, that the end is going to happen. If you keep people safe, you're making this terrible choice. It's going to destroy industry. I would say to anybody in the industry that having the power when there is a serious human health issue, and only then, to be able to have the power to recall products and have fines determined by a court to make sure that the court can appropriately disincentivize that bad behavior and punish those who do it, is just good common sense, and it makes the Canadian brand strong. And if you're a compliant business, or you're a business that's even trying to be compliant, this will cost you exactly $0. And if you're a consumer, you're going to be able to see that made in Canada and know that the product you're taking is safe. That's worth a lot. And when we sell that product around the world and they see made in Canada and they can see that it's safe, that's worth a lot. And I think we need to protect that. And one of the reasons why I'm being so forceful here today is because there's been so much misinformation that we have to spike through that misinformation so that people hear the truth. We should not fear. If you are a compliant business or a business trying to be compliant, you have no cost, nothing to fear here. Just like if you're not committing crimes, you don't have to worry about the punishments of a crime.
Why do you think that the Conservatives did not want to ask questions today specifically on this bill that they put forward?
Well, I think there's been the misinformation on this thing. It's existed in a very small quarter, and there's been some people very invested in spinning misinformation. And I think some people have been caught up in it. And I think that it's too bad that that has occurred.
Point of order.
Because the truth and the facts on this are completely separate and apart. And there's
Minister, please, we have a point of order from Ms. Goodrich.
Thank you, Mr. Chair. I very specifically asked all of my questions directly on this bill. And so being characterized of avoiding questions on this bill is completely misleading to Canadians.
Ms. Goodrich, a point of interruption is not a point of order and doesn't take precedence over the questions and answers. Quite frankly, you know better. 30 seconds, Mr. Minister.
I'll end on this. Right now, we're seeing a return of measles, of tuberculosis, of syphilis, and it's because of misinformation. It's got to stop. We can cross swords in a lot of places, but misrepresenting health and misrepresenting what is happening in health costs lives, and we can't afford it. So let's have a straight conversation about what is and is not happening, and let's stop in the nonsense of peddling misinformation.
Thank you, Minister. Thank you for the extra time that you've afforded us. Good luck with your press conference. I hope this is the most challenging thing you have to do today. We're going to suspend for 3 or 4 minutes to allow the minister to take his leave and to have Mr. Lee join us. So we'll suspend for about 3 to 4 minutes for the second panel. Thanks again, Minister. We're suspended. Being back to order, we're going to continue with the second part. Please allow me to welcome from the Department of Health, David Lee, Chief Regulatory Officer, Health Products and Food Branch. And I don't anticipate that you have an opening statement. I propose that we proceed directly to questions. With the Conservatives, who would like to begin? Dr. Ellis, please.
Thank you very much, Chair. Thank you to the witnesses for being here. Obviously, you all were part of this. I find it fascinating to hear the minister say he's such a fan of the industry and characterizes factories full of feces. Now, I know that he found that quite humorous, but I would suggest to all of you sitting there in a $13.2 billion industry, and we'll have a chance to hear from industry folks on Thursday, thankfully. But can you, for Canadians, could you tell us how many factories full of feces that were actually found? Anybody? How many factories full of feces? That's a direct quote from the minister. How many factories full of feces were found? Just a number is great.
Thank you for the question. I do not have a specific number specific to rat feces.
Yeah, thank you very much. Well, let's scale it back a little bit from the rhetoric delivered by the minister. How many factories were found to have feces?
Thank you again for the question. We have statistics on what we found of a variety of natures that were of very serious concern to us. I can certainly provide some data in that respect. I do not have a number specific to feces.
So I guess through you, Chair, I find that very concerning, and I would suggest our industry folks would find it very concerning that the minister went on at length about rat feces and urine and lead and fiberglass and all kinds of other incredibly specific things. But when you look at that, you're telling me that you don't have any evidence to say that that is actually true?
Thank you for the question. No, that is not true. We have evidence. We have been undertaking proactive inspections of facilities in this industry. And I want to underline, we have very compliant players in this industry. But for example, in 1 year, after undertaking proactive inspections, we found 42% of sites that had non-compliances or conditions that were of serious concern.
Thank you very much, Ms. Holiday. I mean, again, you know, I'm asking very specific questions here to which, sadly, on behalf of an industry that, again, is $13.2 billion to Canada's GDP, 92,000 jobs, and I would suggest to you approximately 70 to 90% are female entrepreneurs in small and medium-sized businesses. We just had a minister here with his bombast and utter foolishness suggesting that there were factories full of rat feces and urine, and you're telling me that you can't even tell me how many of these factories there were or if it's even actually true?
I can say that we have seen feces and urine in sites. Exactly how many, I can endeavor to find out. I do not know the exact number. I do think the example the minister was given was an attempt to illustrate the high bar at which we would want to use a tool like mandatory recall. It would be in very exceptional circumstances.
Thank you very much. You know, with all due respect, of course, you know, that's the expectation that folks would have. You would expect, I suspect, in your own home that you don't want any rat feces or urine. That sometimes may happen. That doesn't mean you're a bad person or you're unclean, et cetera. And I agree with the fact that, you know, that recall power would be very important. But once again, with all due respect, I have asked now, this will be the third, perhaps the fourth time, that the ministers quoted these things very specifically. But what you're telling me is that, well, I think it existed, but I can't tell you how many times or how many places of manufacture were actually affected by it. You can't give us a number. Is that true?
With all due respect, I did not say I think. We have had instances. How many? I would want to go back to my team and look at inspection reports. I do not want to give you an inaccurate number, but we have found these problems on site. So there is no, I think, or confusion on that point.
Right. So you have these reports. So we would expect you then to table them to this committee by Friday.
I will talk to my team about the contents of an inspection report, including such things as confidential business information, but I will table whatever we are able to table.
Thank you very much. And I guess through you, Chair, once again, we're back to this issue of production of documents, aren't we? It is my understanding, of course, that here We're actually here to shed some light on things. We're not here, much as Dr. Sharma did last time, made some wild allegations, which again, what we were told when we asked for those documents to be tabled was to go find it yourself. And you know what? That is when the industry, of course, used the esteemed company Deloitte to create a report to suggest how many injuries actually happened, or as Dr. Sharma would have suggested, the hundreds of deaths. But that being said, once again, you're stonewalling a committee who is asking you for documents. You've never actually said, yes, I will provide those. Just tell me, provide those reports, please. A simple answer, yes or no. Table them here to this committee.
There's no attempt to stonewall. I will provide whatever I can, and in fact, I've already asked my team to start working on that.
Thank you very much, but once again, we hear this language through you, Chair. I'll provide what I can. Provide the reports, which the minister states have factories full of feces. This is ridiculous.
We have a point of order from Mr. Naqvi.
I don't understand how Mr. Ellis feels that he is effective by being
I don't think this is a point of order, Chair.
I'd like to hear it, and then I'll decide.
Thank you. By being rude and taking a belligerent tone to really hardworking members of the public service. They are doing their job. They are not partisan actors in this endeavor. They are subject matter experts who are here to assist this committee to have thoughtful deliberation. And by attacking them in manner in which Mr. Ellis is doing that right now and has done so in the past, I don't think really helps any one of us.
Thank you, Mr. Naqvi. Although I agree with you, it isn't a valid point of order. If that's the way Dr. Ellis wants to comport himself, it's not against the rules of Parliament or the rules of procedure. Dr. Ellis, you have 30 seconds.
Much, Chair. You know, trying to get answers on behalf of Canadians, I don't think is inappropriate. I'll turn the rest of my time to Mr. Doherty.
Real quick, to our witnesses, the minister said that he was interested in a robust discussion regarding this, and that I believe he said over 4,500 consultations have been done. To our witnesses, was the Canadian Health Food Association part of those consultations?
Yeah, certainly the Canadian Health Food Association is one of our key stakeholders with respect to natural health products. Beyond the kind of formal consultations that we have with larger groups, there's a lot of direct
So they were,
they were, yeah. And as well as this department and deputy minister, and then individual consultations as well.
Thank you.
Thank you, Mr. Doherty. Next, Dr. Pawlowski, please.
So the
for 6
Conservatives wanted
minutes.
to spend their whole time talking about rat shit in factories and how much is acceptable to them. Let me ask you another question regarding this PMPRB, which my understanding is it removes the applicability of Vanessa's law to natural health products, which removes the ability to recall natural health products, to impose higher fines when there's violations of safety requirements. And it also removes the requirement of mandatory reporting. Is that mandatory reporting both for adverse effects of the actual drug, but mandatory reporting of harmful interactions with other drugs?
So as you noted, there are authorities that we have under the natural health product regulations, and these are dealing with the authorities under Vanessa's law. So currently under the natural health product regulations, a company is required to provide adverse reaction reports within 15 days if they're serious domestically or serious unexpected internationally. The reporting in Vanessa's law, which is not in effect yet, you would actually need regulations to bring that into effect, would be reporting of adverse reactions in hospitals. So mandatory the way that we do for prescription drugs and non-prescription drugs. And then just if I could use this opportunity, the one comment I think that was made in committee previously around Health Canada already having the authority to make a label change, so it adds, for example, a serious warning to a label, is something that's in Vanessa's law. It is not in the natural health product regulations. So if you take them out of Vanessa's law, we also lose the ability to make a change to a label to add a serious warning in the case of a serious or imminent health.
Now the conservative perspective on this is these are overwhelmingly safe products. There's not many, if any, adverse effects caused by natural health products. I think both of us know that's not the case. There's certainly lots of case reports in the literature of lead poisoning, including in Canada, from Ayurvedic medicine.
Point of order, Chair.
I can quote a...
We have a point of order from Dr. Ellis.
Incredible respect for Dr. Pawlowski, but I'm not sure with which testimony he's putting words in the mouths of conservatives that we said these were overwhelmingly safe products. I don't think anybody ever said anything about that. So please, if he would, just conduct himself with comport.
That is not a point of order. Dr. Pawlowski, back to you.
And I will accept Dr. Ellis's advice on that matter. And let me cite another study, an NIH-funded study looking at drug-induced liver injury, which concluded that 16% of cases of liver injury were caused by herbal and dietary supplements. Do you want to talk a little bit about other examples of adverse effects of natural health products?
Thank you, Chair. So in terms of natural health products, I think we're all in agreement. They are an important part of the healthcare system. It's important for Canadians to have products that they can use to treat minor ailments, prevention, and over 75% of Canadians use them. So that's the first part of it. The risks associated with them, they are overall as a category lower risk than prescription products, for example. That does not mean that there are no risks. So there are risks of the products themselves. There can be risks of problems with manufacturing. So we've talked about contamination. And the risk of contamination with the bacteria of a natural health product is the same as it would be for a non-prescription drug, is the same as it would be for a prescription product for someone who's, for example, has an immune system problem. And then the last sort of section of risks is what we've alluded to is if there is an erroneous impression about the use of the products, then there could be the risk of using products and potentially not seeking care. So in all those three categories, there's examples we can offer.
Do you want to also briefly talk about drug interactions? I've got a Canadian Medical Association journal that estimated that only 10% of adverse reactions are reported. Drug interactions, and Dr. Ellis referred to this early on in his question about the frequency of drug interactions. I know there's quite a few drug interactions with natural health products, for example, affecting the INR of Coumadin. It's less well known on newer anticoagulants like dabigatran, but it also affects the plasma. Some natural health products like St. John's wort can affect the plasma concentration of cyclosporin with organ transplants, antiretroviral levels. Can you talk a bit about drug interactions between natural health products and other medications?
Chair, I think the examples are very salient examples. I'll just give another example with St. John's wort. So it's a product that's often used for mood disorders or for anxiety, but it can actually change the levels of some antidepressants in the body. As you noticed, there's also some vitamins that can actually predispose people to increase clotting. So there's a lot of interactions. So again, it's not just in the natural health products. We have foods that have interactions. Grapefruit juice is kind of the classic example that we have. So there's lots. Any product that can have an effect in the body could potentially have a negative effect, and then there's a whole series of products that could have as well interactions with other pharmaceuticals or other health products.
Do you want to just reiterate this? This came up earlier, but I think it's an important point. The difference between a stop sale, which the Conservatives say currently exists, and the ability to recall products, and how this PMB would affect that.
Thank you very much for the question, Chair. And I welcome the opportunity to explain the difference. We, as the regulator, can order a stop sale for any parties that we directly regulate. So if we issue a license to a party, if we have regulatory oversight, we can issue a recall. Manufacturers, distributors, packagers, labelers, that does not apply to the retail level. That is not within our mandate to regulate retail. So we have that stop sale power, but it does not apply to the retail space. We had a gap. Vanessa's law for NHPs filled that gap with the ability to order a recall including to retail level.
Thank you, Dr. Pawlowski. Ms. Hollett, suite Mr. Thériault pour 6 minutes, s'il vous plaît. Oui.
Mr. Thériault for 6 minutes, please. Thank you, Mr. Chair. Dr. Sharma, you are a scientist. Do you consider that pharmaceutical drugs and natural health products are of the same nature?
Merci pour la question.
Thank you for the question.
Natural health products and pharmaceuticals, prescription or non-prescription, are the same in that they are something that's used for a health purpose.
That's not my question. Do you consider that pharmaceutical drugs and natural products are of the same type or nature? It's a simple question.
So in terms of their nature, they're used for health purposes, so that's similar, but they are different products and they're used for different purposes and they have a different risk profile.
I've already asked you to table with the committee the adverse effects of pharmaceutical products. That is yet to be done. Why?
We have submitted to the committee a 10-page document with adverse reaction reports, and we've received receipt of the fact that we've tabled those, so I'm not sure.
Point of order.
From Ms. Goodrich.
As this is something that my colleague has asked for that I think is very relevant to the study that we're taking on, when can we expect to receive that?
When you have the floor, you get a chance to ask that question. Go ahead, Mr. Thériault.
Isn't it true that there are many more adverse effects with pharmaceutical products than natural products? Yes. Okay. Some products that are on sale, free on sale, is it required that everything be written? Maybe for a frequently used product like Tylenol, that this could cause injury, liver injuries. Could you please repeat the question? What I said is it possible that the more than frequent use of a product like Tylenol can lead to lesions in the liver?
Yes, certainly the Tylenol or acetaminophen has a quite narrow safety profile. So it is quite easy to go beyond, if you go beyond the prescribed or the recommended dose, it can be very severe liver toxicity.
Do you require that this adverse effect be specified on the packaging? So if I buy a Tylenol, I will see written on it that frequent use of Tylenol will lead to lesions in the liver.
It's very specific in terms of the dosing. And then we've done a lot of education and we put out advisories on the concerns of exceeding those doses. There's been a lot of work on acetaminophen specifically.
Voilà. Là où je voulais en venir.
That is where I was getting to. Is it not the role of Health Canada that when we talk about interactions between drugs, is it not the role of Health Canada to put every measure in place in order to educate people, in order to inform people, raise awareness, and go beyond these issues? And at that point in time, we will be able to address many of the adverse effects relating to these interactions, because it is obvious that there could be interactions between highly toxic pharmaceutical drugs in relation with other products that may be natural health products. So what are you waiting to do that?
So, Chair, I mean, I think at the base, the appropriate use of any health product is something that's shared across different players in the healthcare system. I think Health Canada, from our perspective, we take our role very seriously in terms of the regulation of the products, in terms of sharing that information, in terms of openness and transparency. We do have information on the website regarding the way that natural health products are regulated. Part of that does include some of the risks that are associated with it. We do make reference to interactions, but then also on each product, with respect to whether it's
Mais
in a
il y a
product
pas,
monograph or
il y a pas de
information, there's
campagne.
information
Il
around.
n'y a pas de campagne.
There are
qui a
no
été faite
campaigns
en droit
that have been organized population targeting the population. Now, regarding the methodology used, I think I've quizzed you on that already. The minister talked about information. Is it not true that there was an issue with the methodology? Did you question the methodology used for the report? Because
des inspections qui étaient
it was not
aléatoires.
the
C'était des
inspections that
inspections
were
ciblées. Il y a des gens
arbitrary.
sont
These were
allés
targeted
inspecter,
inspections.
là
People
où ils
went
savaient qu'il y avait des
and
problèmes.
conducted
Et donc, après
inspections
ça, on donne
where
un
they know there were,
pourcentage
where they knew there were
en lien
challenges,
avec l'industrie,
and
comme
after
si
that you come
tout
up
le
with
monde,
percentages
ou un gros
relating to the
pourcentage des gens
industry
étaient
as
pas
if
conformes et
to
avaient des
say that
problèmes
everybody or most
de
people
l'inspection.
were
Est-ce que
not
vous avez
in
questionné
compliance.
et
So
pourquoi
did you
vous avez
question
publié
the
des chiffres
methodology, and why
qui
did you
ne parlaient
publish
pas de la
or put out
méthodologie
numbers
employée?
that do not equally criticize the methodology
Thank you
that
very
was
much,
used?
Chair, for the question. So in any inspection program, and we regulate quite a few different commodities, as you know, at Health Canada, one of the basis of all inspection programs, a common basis, is that we make our decisions on a risk basis. Nowhere is that more evident than in inspection programs. So we look on what we call to have a risk profile of entities. Many factors go into that risk profile, but that is how we decide where we need to inspect. So especially in a sector where we haven't been inspecting for a long time, it is not at all unusual, and in fact, it was quite intentional that we would go where we thought risk was highest.
Est-ce que c'est... Pardon?
C'est tout. Mr. Julian, please, for 6
Your
minutes.
time is up.
Officials for being here. We appreciate your service to the country, and I apologize for some of my colleagues who have taken a very aggressive and inappropriate tone. I want to come back to the issue of non-compliant companies, because I think this is really at the heart of the debate and discussion that we're having around the bill itself. We were talking about 350 recall notices. That is from what date to what date?
Approximately the last 5 years,
Okay.
2019.
Yes. And similarly for the 31 public warnings. Yeah. That come down to 3 companies that were not complying. Are those 3 companies still in operation?
I would have to check that. Sorry, Chair, I would have to check that, but I can commit to get that answer to the committee.
Because, I mean, those companies are subject to approval by Health Canada. So in any of those 3 cases, was there revocation, the natural health product number, or a cancellation of their product, or any other measures taken against those 3 companies?
Thank you for the question. So in all 3 cases, plus some of the additional 350 other measures, yes, would have been taken. Everything from either intent to suspend a license, revocation, stop sale. With many of those tools, what is often the case is something can be put in place temporarily, or as I said, some are of the basis of intention to. So what I would want to check to give you a complete answer is what the current status of any additional tools that we used, what the current status of those are, keeping in mind some of these go back to 2019.
Okay, but so that there, Mr. Paul before this committee, and he wasn't wrong to say that there are other provisions and tools that Health Canada can take. I think it would be very helpful for this committee to understand in each of those 3 cases, which seem to be the egregious ones. No one disagrees that the vast majority of companies in Canada work in a very responsible way. They believe in the natural health product industry. They want to make sure that they're offering the best quality product. And in the vast majority of cases, they comply voluntarily. So I think it's important for the committee to understand, for us to know, in those rare cases, 1 in 100, from the statistics that we seem to have before us, what are the other tools that Health Canada has employed against those companies who simply refuse to be compliant and who essentially stain reputation of all the other companies that are complying. I want to come back to the public notices then, because you had spoken earlier about the impacts of delays. In those 31 cases, it appears that there were delays in the companies then voluntarily complying. Can you give us a sense of the average length where a company didn't comply with an initial voluntary recall, but then did comply once Health Canada provided a public warning?
Thank you for the question, Chair. So with respect to the first sort of what a norm would be, in the world that we're speaking of, we have 3 different types of risks, type 1, 2, or 3, and they're all based on an imminent risk to health, and then it flows from there. So in a type 1 risk, for example, which is the most serious, carries the most possibility of negative health impacts or risk to Canadians, our expectation is immediate action on the part of the company. So they let us know of an issue, we let them know. It really doesn't matter. If it is of the type 1, we expect immediate action.
When you say immediate, is that 24 hours? Is that 1 week?
Yes. So we have a service standard internally in which time to engage the company. And when I say we would expect immediate action, it would be agreement to a plan and beginning the implementation of that plan 24, 48 hours immediately. And then if I may provide an example, so when I say there were delays when potentially dangerous products were remaining on the market, we did have one instance where we asked a company to recall. We asked multiple companies to recall. The majority of companies agreed. One company did not. And we had to find another way to have dangerous products removed. And so what we did in that instance, I mentioned it earlier, was engage other parts of the supply chain, in this case, distributors. It is not their responsibility. It is the license holder's responsibility. And by the time we were able to find someone else in the supply chain willing to do a recall, we're speaking weeks, 3 weeks, 4 weeks. We have another instance of 6 weeks.
Okay, so coming back.
Thank you. Sorry, Mr. Julian, that's your time.
I still have 30 seconds, Mr. Chair. It's 6-minute rounds.
Yeah. Oh, did we start late? Okay. 30 seconds, go ahead. The clock I was looking at had you at a time, obviously.
I'll take the 30 seconds.
Go ahead.
Thank you. 72 cases of adverse reaction in natural health products. How many of them would you attribute to those 31 public warnings?
Thank you for the question. We do track the origins of what leads to compliance action, whether it's a trade complaint, an adverse drug report. Specific to those 31, I will need to confirm the number. We do track that information, and I'll be happy to share it.
Thank you.
Thank you, Mr. Julian. Next, Mr. Doherty, please, for 5 minutes.
Thank you, Mr. Chair. I just want to give our witnesses another opportunity. I want to again ask on the record that Ms. Hollett and Dr. Sharma, again, was Canadian Health Food Association consulted either for Bill C-368 or Vanessa's law?
Yes, for both.
Okay, so through you, Mr. Chair, I'd like to introduce Aaron Skelton, the CEO of Canadian Health Food Association, as well as 2 executives, Sonia Palmer and Jules Goran, who will provide testimony later this week, but that they were not consulted on this. They are in the audience, and perhaps after this meeting, I can introduce our witnesses to them because they were not consulted on either C-368 or Vanessa's law. And with that, I'll cede my floor to my colleague, Ms. Goodrich.
Thank you, Mr. Chair, and thanks to the witnesses. So to follow up on what Mr. Julian was bringing forward, the 31 that were found to have the public advisories noticed, then there were 3 that were uncooperative. Of those 3 that were uncooperative, how many of those led to negative health outcomes?
Thank you for the question. I would not have a line of sight to be able to give you a 100% accurate answer. Of those, is there a potential that despite our risk communication, despite a recall, there were negative outcomes? We would need 100% assurance that all negative outcomes are reported to Health Canada, which unfortunately we do not.
Okay, I fully understand that you're not going to be able to gather all this data because this is imperfect circumstances. But does anywhere in the behemoth that is Health Canada have any data on how many negative health outcomes were to the 350 that were flagged as problematic, the 31 that had public advisories issued, and the 3 that were uncooperative? Because this is germane to the conversation we're having. And so the fact that you don't have these statistics for us readily available, to me, it says that there was a failure in preparing to come to this committee today. And so my question to you is, can you have this information to us as soon as possible of the information that Health Canada knows? I understand that that's not going to be completely, and that not every negative interaction will be reported to Health Canada, but we need to know what Health Canada knows, because right now we're being told basically just trust us.
I think there was a question. Thank you for the question, Chair. As I mentioned in response to MP Julian, we will table the information that we have, the adverse drug reactions that were reported to us that were linked to the 31 products we're talking about for which we publicly communicated.
Okay, and so this becomes part of this complicated space. I had asked the minister earlier about the gender-based analysis that was done on the Budget Implementation Act. Could you table that information with us, or share more information about the specific findings of your gender-based analysis?
Certainly, we can table it. And I will just note that there's different aspects of the SGBA analysis. So one is, obviously the impact on the companies as well, but also with respect to Vanessa's law, when you look at natural health products, the users of natural health products are disproportionately women, Indigenous populations, people of the LGBTQI population, Indigenous ethnic groups. And so part of that assessment also is Vanessa's law provisions also contribute to the safety of those products and then benefit those groups as well. So it's both on both sides, but certainly we can table the analysis with the
Well, and I think this goes back to the fact that the minister went on at length talking about possibly the most egregious circumstance that was found, which from the testimony we've heard through the rest of this meeting, sounds like that was a one-off and a very rare circumstance, not the standard that you guys see. But he painted it like that is a regular occurrence that you guys are dealing with. And so I think Canadians need to know how often are you seeing those exceptionally egregious circumstances that were described by the minister, and described by the minister as if that is the common practice?
Thank you for the question. Again, we commit to share information with this committee on those most serious of incidents. What I would add, although not all rat urine, feces, what you can tell from the stats we've already provided is that in the last 5 years, there were at least 31 where whatever the circumstance was, whether it was contamination, whether it was sanitary conditions, we believed the bar was met to need to warn Canadians about products and conditions and risks. So that's 31 in 5 years.
Thank you, Ms. Hollett. Next, Dr. Hanley, please, for 5 minutes.
Thank you. Thank you for being here, and thank you for your service. Dr. Sharma, the 2021 Auditor General's report said Overall, Health Canada's oversight of natural health products available for sale in Canada fell short of ensuring that products were safe and effective. The department did approve products on the basis of evidence that they were safe and effective. However, gaps in the oversight of manufacturing sites and in the monitoring of products once on the market left consumers exposed to potential health and safety risks because products were not always manufactured or marketed according to license conditions. Do you feel now that with applying Vanessa's law to natural health products, that the regulatory gaps referred to in the Auditor General's reports will be addressed?
Certainly, the Auditor General did a comprehensive look at the system with respect to natural health products and raised a number of issues. We've accepted all of those and have endeavored to make improvements. Vanessa's law goes part of the way to improving the system. I think, you know, the ability to mandate a recall in exceptional circumstances for serious and imminent threats, the ability to compel a change to a label, again, if it's serious, is very important. Fines and penalties without having regulatory requirements, without having kind of that regulatory backstop of appropriate fines and penalties, which before Vanessa's law were only $5,000, makes the system rather toothless. There's also other provisions, again, that we haven't yet put into force with respect to reporting of adverse drug reactions, terms and conditions, and other tools. So with those tools, it does go a certain way to improving the system. I think there's still other modifications and improvements that can be made. We've talked to the committee about some of those other initiatives that's separate from what we're talking about today. But certainly, Vanessa's law does really move the bar in terms of bringing the regulation of natural health products up to a minimum standard that we would expect for all therapeutic products in Canada.
Thank you. I recall Mr. Calkins saying, really, if I can paraphrase him anyway, you know, we already have everything we need already in place with existing regulations to address noncompliance or to remove contaminated or high-risk products. So, what are your thoughts if 368 were to pass and we were to revert to existing mechanisms? What are the potential consequences?
Thank you very much, Chair, for the question. So, in essence, this is not even a theoretical question because we lived it prior to adding Vanessa's law authorities to NHPs. So there are many consequences, but maybe I can highlight three that are top of mind for me. Number one, and there's been a lot of discussion about this today, when we have the most serious of situations and we do not have a cooperative entity, a cooperative company, and again, I will stress that is the minority of cases, we will not have a way to remove products from retail shelves. And I firmly believe that Canadians think their health regulator has that ability, and we would not. Two, if someone were not to maybe disobey a mandatory recall or in some other way strongly be in strong noncompliance with the regs and the Act, and we wanted to move after we had mitigated risk to punitive, our stick would be very, very small. You heard $5,000 in fines. We also, in Vanessa's law, it hasn't gotten much attention today, also have the injunction authority. So if someone was willfully non-compliant, the tools to follow that up with, we would be very hard-pressed to follow that up in a meaningful way.
Thank you. And, you know, I think we all agree, you know, natural health products are at the heart of an important and I would say a cherished industry by Canadians. We all recognize the value of small businesses that are the front line of natural health products. So what would you say about the projected impact of Vanessa's law on small businesses that sell natural health products?
Certainly, I mean, it depends on which study you look at, but definitely more than 60% of the natural health product companies are smaller or medium-sized. And so overall, with respect to Vanessa's law, there would be minimal impact because, again, these are only circumstances where you've got a serious safety risk and then you've got a company that's not complying with that safety risk. The example that was used in the Auditor General's report was actually a tea extract. and it was contaminated with something called mycophenolate, which is a pharmaceutical product that's used for immunosuppression in people that have had organ transplants. It was first noted in 2017. By 2018, the company still hadn't recalled. By 2020, they were back on the market online selling these products. And exposure of mycophenolate to women who are pregnant can cause miscarriages and birth defects. That was the example that was in the Auditor General thing. So for a company that is small or medium-sized in this environment, I would think that they would want companies that are not compliant, that are not abiding by the rules, to have some corrective action and to have circumstances where we can create a level playing field. And again, if you're making a quality product, you're abiding by the regulations, this would not have an impact. And actually, there's provisions in Vanessa's law, it gets into the technicalities, but incorporation by reference.
Thank you.
That actually would be advantageous for businesses to help them in terms of standards. And
Thank you, Dr. Sharma.
Yeah, useful.
Thank you. Thank you. Monsieur Thériault, 2 minutes et demi.
2 minutes and a half, Mr. Thériault. In the executive powers that you get with the Vanessa Act, you talked about prohibiting people from publishing fake or false information, and I have a hard time believing that you need the Vanessa Act in order to come up with these prohibitions. Am I mistaken?
So there already are provisions in the Food and Drugs Act around advertising. So for example, Section 9.1 of the Act talks about you can't make an erroneous or untrue representation of a product. However, because of NHPs, if they were not in Vanessa's law, the maximum fine, if a company did not then remove that advertising or remove that misinformation, would be $5,000. So that's one example of how Vanessa's law's provisions with respect to the fines and penalties would directly help us in terms of enforcement on the misinformation and disinformation side of things.
Because you believe that you can come to an understanding with the pharmaceutical industries to get to a point where bad actors have punishments that are higher than what exists currently. I think it takes the Vanessa law. A moment ago, I asked the question, are there more adverse effects with regard to the pharmaceutical industry? You responded yes. So by putting natural products in the same category as therapeutic medications and medical prescriptions, are you considering that this is an equivalent level of risk?
The natural health products are treated differently than other products through the natural health product regulations. The Vanessa's law provisions do not change that. There's a different set of assessments for approvals for natural health products. There's requirements for good manufacturing processes. There's a lot of provisions, and so those are staying. Vanessa's law, just for purposes of serious and imminent threats on specific issues like recall, like mandating a label change for something serious, brings it into the therapeutic product category. But it doesn't mean that they're treated the same way.
So if we amend the bill, you acknowledge that we need separate rules for that. So if we amend the bill, at that point in time, we would have met the objectives that you're targeting? Do you want to respond?
I think it's up to the committee. If committee members want to provide some amendments, we're really here just to sort of speak to the technical questions.
Okay. Thank you. Final round of questions for this panel will come from Mr. Julian for 2.5 minutes, please.
Thank you very much, Mr. Chair. I just wanted to reiterate in terms of what I've asked that you're committing to bring back. First, the results of those 3 companies, like whether those companies are still in business or not, whether they've had licenses suspended, the 3 companies that were non-compliant, the actions and tools that were used by Health Canada over the period with these 3 companies that were non-compliant, and the number of adverse impacts of connected to natural health products among the 31 warnings that were issued. That would all be very helpful, I think, to members of the committee to consider. Now, Ms. Hollett, earlier you were speaking about the three categories. You spoke to category 1, which was immediate, a 24 to 48 hour reaction time. I would like you to speak to 2 and 3 as well. And I'm assuming that the 31 public warnings were all category 1s, but just wanted to clarify that with your confirmation.
Thank you very much, Chair, for the question. So if I could actually start with the last part of your question. Usually, and by that I mean the vast majority of times, yes. If we are publicly communicating on a risk issue, we are talking a type 1. However, we do communicate on type 2s on occasion, and I will just give a quick example. If perhaps the risk is specific or heightened for a vulnerable subpopulation, then we can communicate on a type 2 as well. We would very rarely, if at all, communicate on a type 3. So there are 2 things that we're talking about in tandem. The type 1, 2, and 3, I'm speaking of risk. So with colleagues, scientific experts at Health Canada, we determine the level of risk. And then that correlates to what I was speaking about, which are service standards or the time that we take, for instance, to first action or expecting action on behalf of the company. So in type 2, it can be quite a range because, again, even if a risk is determined in general to be a type 2, if we have a vulnerable subpopulation that we're speaking of, then the timelines and what we deem reasonable could be very similar to type 1 in terms of its immediacy. So really in that type 2 category, there are a lot of factors. I can tell you the criteria that go into what we deem reasonable are obviously the nature of the risk, vulnerable subpopulation, how much a product has been sold in Canada and how widespread its use is. And then in type 3, definitely the lowest of risks. We have more time, perhaps 2-3 weeks, but we still look for progress on part of the regulated party. What is your plan? What is the critical path for implementing that plan? So even though the timeline is expanded, there are milestones along that timeline when we would expect to see certain progress met.
Thank you, Ms. Hollett. And that concludes our rounds of questions. Please don't run away, colleagues. I've got a couple of housekeeping matters to deal with you on. To all of our witnesses, as always, thank you for your patience and professionalism in presenting to us today. Thank you for your service to Canada, and you're welcome to stay, but you're free to leave. Colleagues, 3 things very quickly. Because we didn't get to the breast cancer screening report last week, it's been postponed to November 28th. On the opioid study, we have 2 more meetings left. The witness panels for both have been confirmed, but we should set a date for the submission of briefs. If I could suggest Friday, November 22nd. Is everyone okay with that for submission of briefs on the opioid study? I see heads nodding around the table. Thank you. And finally, this is something that should be dealt with in camera, so I don't propose to raise it here, simply to alert you that you're going to be receiving an email with respect to a group called Advancing Cervical Cancer Screenings Consensus Group. It includes an associate professor, it includes a professor from France that wants to meet with us in some format. Please pay attention to the email and get back to us because it is time sensitive, but also sensitive enough that we shouldn't be discussing it in public. Is there any, that's all I have for you. Is it the will of the committee to adjourn the meeting? Yes, sir. The meeting is adjourned.